Hi, it's Paul Mears here, Chief Executive. I'm just giving you an update from the May board meeting. We had a very busy day at our board meeting last week. It started off as always with a patient story, and this month our patient story was delivered by Lindsay Birmingham, our matron in maternity, who told us a very complex story about a patient that she'd been working with in conjunction with colleagues across the hospital and indeed outside the organisation to manage quite a complex patient who had a variety of needs. And the patient story really described how in the run-up to the birth and during the birth this patient had been managed very effectively, not just by our own staff within the organisation but in very close cooperation with colleagues in social care, the police, other statutory agencies around Yeovil. So it's a really good example of how often our care for patients in the hospital is not just determined by what we do here within our own organisation, but how we work in a joined up way with our colleagues. So it's really good to hear that example from Lindsay and colleagues. And it was a real reminder to the board of just how important it is that we carry on building and developing our partnerships with other organisations for the benefit of our local community. We then began the board proper and as always had a variety of reports about our operational performance. It's really pleasing to see our operational performance being so good. Our scorecard is pretty much green across the board with great performance in A&E, our waiting times in our RTT and our cancer standards. So it's really positive to be able to report to the board such great work that's going on across the hospital that's delivering great operational performance. We also reviewed our first month of our financial year, so April financial performance. There are some challenges in April linked predominantly to our activity levels, so the amount of demand coming through the hospital had dropped both for non-elective patients and elective planned patients, but we are anticipating this will get back up to the planned levels in month 2 for when we see the final May numbers. But again, we were able to talk through our board about the activity implications and what that means for our financials at the first month of the financial year. On the quality front, Sheila Meldrum, our Director of Nursing, and Tim Scull, our Medical Director, gave an overview of current performance around quality metrics, and again, overall performing very well. Though Tim Scull did also go into some detail with the board, describing some of the work we're doing at the moment to look at mortality rates and described how we go about reviewing mortality across the hospital. Obviously, whenever we have deaths in the hospital, it's really important that we understand, was that expected, and if not, why, what happened, and make sure that there was nothing untoward that could have influenced that. And there's a lot of work that Tim is leading with Joe Howarth in clinical governance, looking at how mortality can be managed and reviewed on a regular basis across the organisation. We also were able to take a time to update the board on our progress of implementation around Track Care, our electronic health record, and we were describing to the board members how our next phase of Track Care planning is going. The next phase will go live later this year with pharmacy stock and e-prescribing, so we updated the board on that. And we also talked to the board about how we as an organisation have been safeguarded from the recent cyber attack that many of you will have heard about, that's impacted on many organisations in the NHS. Fortunately, our organisation was protected, but thanks to in no part to the lot of hard work that's gone on by the IT team, who have done a lot of hard work to make sure our systems are protected from these sorts of systematic attacks, and indeed we're able to respond very quickly when we were alerted that there was a risk, and we're able to reassure me and the board that the risks to this organisation were very much minimal thanks to their hard work over the past few months. The other presentation we had at the board this month was about the work we're doing to look at benchmarking our performance as an organisation against other hospitals across the country. NHS Improvement, who are our regulator, have produced a tool called the Model Hospital, which really benchmarks our performance against other hospitals across the country in all sorts of areas, both in terms of workforce, staffing, numbers, costs, finance, quality, performance measures. So it's a really useful model to be able to make sure that we are trying to achieve the best standard that we can possibly achieve, but also recognising that it's always useful to be able to see what other people are doing and how we benchmark. So it looks at things like our costs compared to other similar sized hospitals around the country, and it's just a really useful indicator for us to understand how efficient are we, are there areas where we could be doing better. And John Standing, our chief pharmacist, came along as well to describe how he in pharmacy has used the Model Hospital dashboard to understand what we are doing in our own pharmacy department and compare and contrast how our performance in pharmacy fits with other organisations, which is always helpful to really understand, is it just about how we are reporting data differently, or is there genuinely something different that we could be doing to learn from other people and actually produce better results in terms of outcomes or greater efficiency in the way we run our service. So a really useful opportunity to update our board members on that model hospital work as well. So again, it was a usual very full day, lots of topics discussed and lots of information shared with our non-exec directors. But I shall be giving you another update on the June board as usual. But if in the meantime there's any questions, you can always feel free to drop me an email and ask me anything in the meantime. Thanks very much.